The os coxa is a single bone located medially in the body and expands superiorly and inferiorly. The os coxa articulates with another os coxa that is a mirror image of itself. Together, both bones provide protection for visceral organs, structural stability, muscle attachment, and synovial joint articulation. The os coxa is composed of three major bones: the ilium, the ischium, and the pubis. Each bone is of importance to the pelvic girdle, which surrounds the pelvic cavity. The ischium and the pubis compose the inferior portion of the os coxa. The pubis is located ventrally and anteriorly. The pubis can be divided into three areas: the body, the superior, and inferior rami. The ischium forms the dorsal and inferior portion of the os coxa. Fairly similar to the pubis, the ischium is formed by a superior body and inferior ramus. On the dorsal side of the os coxa is the acetabulum. The acetabulum is a concave surface which forms a ball and socket joint articulation with the femur. The ischium makes up about 2/5 of the acetabulum. The ilium forms the superior portion of the acetabulum, accounting for less than 1/5, whereas the pubis makes up the rest of the acetabulum nearest to the midline. The ischium forms the posterior-inferior region of the os coxa. It is inferior to the ilium and posterior to the pubis. The word ischium is derived from the Greek word ischion, meaning hip. It is a distinct bone at birth, but later fuses with the ilium and the pubis, completing its fusion by puberty. The most superior and dorsal of the ischium is the ischial body. The ischial body begins from the lower 2/5 portion of the acetabulum, just below the greater sciatic notch. It has an arch-shaped appearance, thick exterior, and ultimately transitions into the inferior ramus. Inferior to the greater sciatic notch of the ilium is the ischial spine. The ischial spine is a triangular structure protruding from the ischium posteriorly. The ischial spine is the attachment site for the sacrospinous ligament, which limits the upward tilt of the sacrum. Inferior to the ischial spine is the lesser sciatic notch. The lesser sciatic notch is a concave indentation similar to the greater sciatic notch. The inferior surface of the ischial body is the thickest portion of the body of the ischium itself. The inferior surface is distinguished by the ischial tuberosity, the strongest part of the hip bone. The ischial tuberosity is a rough, thickened structure that supports nearly the entire weight of the body while sitting. The gluteus maximus, which covers it when in a standing position, exposes the structure while sitting, allowing for palpability. The ischial tuberosity is the origin for the adductor magnus muscle on its lower lateral portion. The adductor magnus adducts, flexes, and extends the thigh. The upper lateral area of the ischial tuberosity is the origin for the semimembranosus muscle, which functions in extension of the thigh and flexion of the knee. The upper medial portion of the ischial tuberosity is the origin for both the biceps femoris and the semitendinosus muscles. The biceps femoris is responsible for flexion of the knee, whereas the semitendinosus muscle flexes the knee and extends the thigh. The ischial tuberosity articulates with the sacrotuberous ligament, which extends from the sacrum to the tuberosity itself. The sacrotuberous ligament has a primary function to stabilize the pelvic girdle and limit upward tilt of the sacrum. The inferior ramus of the ischium is thin and flattened and descends from the ischial body. The lateral border forms part of the medial margin of the obturator foramen. The obturator foramen is a large hole in which surprisingly few vessels and nerves pass through because it is almost completely closed by a fibrous membrane. With respect to the inferior ramus of the pubis, the inferior ramus also serves as a partial origin site of the gracilis and abductor magnus muscles, which both function as primary abductors of the thigh. The ischial ramus joins the inferior ramus of the pubis posteriorly, forming one of the strongest sections of the os coxa. The inferior ramus of the pubis is the origin of the gracilis muscle on its medial border. The ramus also forms a portion of the obturator foramen on its superior medial border. The pubis is the most ventral and anterior of the pelvic bones. It is almost horizontal, allowing for the bladder to rest directly above it. The pubis is a V-shaped structure with the body branching into both rami. The word pubis originates from the word pu and bis, meaning sexually mature. It is covered by a layer of fat known as the mons pubis. Anteriorly from the inferior ramus of the ischium is the inferior ramus of the pubis. As it ascends to the body of the pubis, it becomes more narrow but more rough for muscle attachment. On its medial border is the origin of the gracilis and adductor brevis muscles. The body of the pubis extends anteriorly and ventrally from the inferior ramus of the pubis. The body possesses the pubic symphysis, the articulation point for both os coxa bones. The pubic symphysis is a non-synovial amphiarthrodial joint, meaning it is slightly movable but not multiaxial, and is connected by fibrocartilage. The symphysial surface is beneath the cartilage. It is a rough, bony area where the fibrocartilage articulates with the os coxa bones. The word pubic symphysis comes from the Greek word symphysis, meaning together growing. The pubic symphysis can be distinguished by two structures. First, a thickened pubic crest on its anterior portion. Second, the pubic tubercle, a prominent anterior projecting structure on the lateral side of the pubic crest. The body of the pubis, including the pubic symphysis, make up the medial border of the obturator foramen. Superior and lateral from the body of the pubis is the superior ramus. At the medial end of the superior ramus is the pectineal line. The pectineal line forms the anterior portion of the pelvic brim of the pelvic cavity. The pectineal line is the insertion of the pectineal ligament as well as the most proximal portion of the pectineus muscle.
The superior ramus of the pubis makes up the superior border of the obturator foramen. And forms the superior border of the obturator canal. The obturator canal is the only opening of the obturator foramen not covered by a membrane, allowing passage of the obturator vein, artery, and nerve.
Inferior to the pubic symphysis joint, the two inferior pubic rami and the ischial rami form an arch shaped like an inverted V. The arch is referred to as the pubic arch or subpubic angle. When analyzing a skeleton, the arch is used to differentiate between a female and male specimen. The bony pelvis can be divided into two parts. First, the false pelvis, also known as the greater pelvis, occupies the space above the pelvic brim. It is referred to as the false pelvis because it is actually part of the abdomen and contains abdominal organs. Second, the true pelvis, also known as the lesser pelvis, is inferior to the pelvic brim and forms a deep bowl containing the pelvic organs. Pelvic fractures, which should not be confused with hip fractures, are rare due to the stability and resilience of the os coxa. Pelvic fractures, like hip fractures, occur mostly in the elderly following falls or contact with hard surfaces. If an individual suffers a pelvic fracture, immediate medical attention is recommended. Since the os coxa protects vital organs, internal bleeding commonly occurs. The os coxa are of importance in the pelvic cavity. Not only do they provide muscle attachment and bone articulations, the os coxa protect vital internal organs, including the bladder, colon, and reproductive organs. This video was completed to meet the partial requirements for Biology 11, Spring 2016, Saddleback College.